we can certainly try to block the bottom-up part. We can take the cues away and try to prevent craving and sort of remove all the stimuli, all the bottom-up stimuli. Remove everything. Remove the alcohol. Just sort of do everything you can to sort of not have any bottom-up sort of any kind of trigger. But can we do it the other way? Can we just say, well, that's not realistic. You can't get through life with removing everything, everything that's possibly going to lead to relapse. But can we do something by boosting sort of top down? Can we sort of prevent relapse and improve faulty decision making and decrease the impulsivity that we see sort of in our patients? And so can we do? And so the question is that can we do this by boosting the dopaminergic system? And so there's been a really interesting kind of the way cognitive neuroscientists are sort of tackling is with this delayed discounting task. Has anyone heard of this sort of task? It's sort of a really neat task in that, it's this idea that you just simply give subjects a choice. Do you want $75 today or $100 a week from now? And you keep varying it. And you can actually plot out this curve because we all discount a little bit, right? We at some point, if it's too far in advance, we're going to take what's now, right? We can't delay gratification forever. If you're going to give me $1 million 34 years from now, I'd rather probably take $1 million now. So we all discount, we all delay gratification, but we don't do that much. We actually don't do, normally, we don't do that very much. But if you look at addicts, they have this crazy they have this kind of curve in which their value, they really reduce their value of delayed rewards is really decreased. They almost always will want something now instead of something later. And you can actually plot this with a mathematical function. There's this kind of curve where they're going to take less now than more later, regularly, compared to normal. So you just by varying this much amount of money now versus the amount of later, you can sort of plot out these sort of curves, and you can see that and even patients with frontal lobe damage show this. So if you actually have a patient with traumatic brain injury, and you sort of look at them, how they perform on this task, they do the same thing. They will take more now than wait till later. And it doesn't matter if it's money or a discount voucher or food. They just no delayed gratification at all. They're just consistently show these curves, whether compared to normal. So again, I don't want to say that patients with addictions have frontal lobe damage, but I'm just saying it's a system. This is a severe form of frontal systems failure, and addiction is a less severe form of frontal system failure. They act very similarly. So if you take this task, you can create this ratio. You can basically calculate, okay, do this like 100 times, vary the amount of money sooner than later, ask them which one they want, and then you can calculate this impulsive choice ratio. So how many times do they say they want the sooner choice? They want something less now instead of more later. And so the bigger the number this is, the bigger this ratio is, the more they're sort of saying, I want more now and less later. And this is a group of abstinent alcoholics, and they have significantly increased number of choices wanting things now. They're much more impulsive and saying, I want it now. And it does, and every group that they've done this on, those addicted to opioids, addicted to amphetamines, addicted to nicotine, addicted to cocaine, pathological gamblers, sex addiction, it doesn't matter. They all show the same behavior on this very simple sort of task.